Okay guys, so we're moving on to more advanced post-hip replacement exercises now. So please make sure with your surgeon that you're ready to do these. All you need are 2 pieces of equipment. You need a squidgy ball and also a resistance band for these. These are done in lying, so you're going to take yourself down onto your side with the operated hip up. From there, lying yourself down, you're going to place the ball in between the knees, and we're going to start off with the knees bent and then progress to having them straight. So ankles are in line with the bottom and the knees are bent. From here, fingertips are gently rested and you're going to squeeze the ball as much as you can. If you haven't got a ball, absolutely fine to use a pillow, but what I do like about these is you can see how far you're getting, so it's a really nice way of monitoring your progress. 10 seconds, you should feel that those stomach muscles are kicking in as well, and ease off. And we're going to squeeze again, working those inner thighs, pulling the stomach muscles in. 10 seconds. If you want to make it harder, hand on hip, arm up, and ease off. Perfect. And then to make that harder, guys, straighten the legs out, quite a bit more difficult. And you're going to squeeze there as well. 10 seconds. Really working those inner thighs, pulling the stomach muscles in, and ease off. Okay, we're now going to work the outer thighs into the bottom muscles. So this is the hardest one I've demonstrated so far. So we're going to take the band. You're going to place the band just above the knees. You're going to tie it just like so. So you want a little bit of slack there, but also not too easy, okay? Lying yourself down. We're going to start off again in the bent knee position, then progress. So ankles in line with bottom. On your side, creating a nice gap underneath your waist so that your stomach muscles are kicking in. From there, keep the knees together, keep the ankles together. Take a deep breath in. On the breath out, try and push the knees apart. Now, I don't want you to go too far, because what will happen as you go further is you rotate through the hips and the back. I want this movement to be from the ball and socket of the hip joint, okay? So just lifting, maximum maybe 10 inches, and back down again. Lifting up, working against the resistance of that band. This is hard work. And back down again. You should be feeling it on the outer part of the hip into the glute med muscle. And back down again. To make it harder, you guessed it, you're going to move it just around the ankles. Now, you may need to tighten this band a little bit. This is really getting a little bit more advanced now, guys, so please make sure that you are ready within your program for these exercises. Straightening the legs along, keeping that gap underneath your side if you can, pulling the stomach muscles in. You will need your hand here for support. Keep the underneath leg flat, flex the feet, lift the upper leg away from the underneath one. This is hard work. You're going to hold it there and then you're going to pump it for 10, 9, just a few inches, 8, 7, keep pumping, 6, should feel the thighs and outer glute, 4, 3, 2, and 1. Perfect. And down we come. So it was 10 reps of each exercise. Some of you who are more advanced should be upping the sets you do. So if you can, repeat all of that twice or 3 times. Good luck. So I know I may have made that look really, really easy for some of you at home, and I'm fully aware that not all of you are as fit as me. Some of you may be thinking, don't try this at home, but please do. Take it at your own level, take it gradual. Perhaps don't stretch as far as I did and just gradually build it up as you go along. If you do feel any discomfort at any point, just stop, have a break, take a breather, go back into it. And if you do have any pain that persists and isn't going away, please do seek advice from a medical professional, either your GP or your physiotherapist. And good luck, guys, you've got this.